The next problem is infertility. Infertility, low back pain, and ovarian cysts, and cramping, pelvic cramping. It's all from spasm of the psoas major muscle.
Does that happen during certain times of a woman's cycle, or could it happen at any time?
Could happen at any time, but does it tend to happen more during the cycle, right? Mm-hmm. So, because that's when it swells up, and that's when that area, just becomes very active, right? The ovary has a lot of work to do. If a gland in the body, anywhere in the body, isn't working at full function, the muscles around that gland will begin to contract to try to help it. But then if they contract too much, they go into spasm, involuntary contraction. And with the psoas major, because it's the only muscle that the genitofemoral nerve goes through. So the genitofemoral nerve is the nerve that goes to the ovary, for men to the testes. But for women, it's the only nerve that connects the central nervous system to the ovary. Your ovary actually doesn't have a way to know what time of the month it is, because it needs to talk to the central nervous system to know how many days have gone by, right? Mm-hmm. So if the psoas major is tight, it actually pinches the genitofemoral nerve, and they don't talk, and so you stop having your cycle. And even with menopause, women get a lot of really bad hot flashes if this muscle's tight, because they're not balancing things by being able to communicate and coordinate very well. So I need to add that. Hot flashes.
So releasing that muscle can help with hot flashes.
Yeah, it just stops it. Everybody I've worked on that had hot flashes. You just get this release and it just stops. And also low back pain, of course. Like low back pain is always this psoas major muscle. People are always pushing on the low back, but the problem with low back pain is generally that the lumbar spine are coming into the abdomen too far. And it's the psoas major that's causing it, right? So you can cure low back pain, ovarian cysts, and cramping, and hot flashes.
Lower pelvic pain, lower pelvic floor pain.
No, that's different.
Okay.
It can set off pelvic floor pain, but it is pelvic floor. The nerves come from the tailbone. Okay. So tailbone pain but they're very interrelated though, but it is slightly different. So good question though. And also the psoas major, when it's in spasm, it pushes on a nerve called the femoral nerve. Do you know the nerve? The femoral nerve? The femoral nerve is the nerve that goes to the quadriceps. Mm. So it actually will cause chronic quadricep pain if the psoas major is tight. Have you had that before?
I think
so. Or your quads start locking up because of this? You definitely get some so. Okay, so the psoas major is this muscle right here. And as you can see, these are the lumbar vertebrae. Well, you may not know that, but these are the lumbar vertebrae. You can see the psoas major attaches to the lumbar vertebra. And when this muscle is tight, it pulls all those lumbar vertebrae forward into the abdomen. And it's definitely the strongest muscle attached to the lumbar vertebra, which is why if there's any muscle to look for that might be tight causing low back pain, it's always going to be the psoas major. So the psoas major, it also has the ovary just on the inside for women, obviously not for men. And the nerve that goes to the ovary comes out of L2 and L3, and it goes through the muscle on the way to the ovary. And because it goes through that muscle, if the muscle's tight, it's going to pinch the nerve, the genitofemoral nerve, before the nerve gets to the ovaries. So the ovary is not going to be talking to the central nervous system. It doesn't know what time of the month it is and so on. So this is a cause of infertility. To release it, all you have to do is release the psoas major muscle. So let me go ahead and show you the technique that I use for that. What I do is if you have a tight psoas, then you have to go on there and you find it, and it attaches to the lumbar spine. So you get a pressure point release there, and you try to send a release back into the lumbar spine, and that'll relieve low back pain. So this is how you do it. Make sure that you get that yang-yin pulse, so you slowly increase your pressure, make it then feel like you're slowly backing out, triggering a release. And if you can get this psoas major to release, I promise you, if a cycle hasn't been happening for a year or two, it will start tomorrow morning if you get this muscle to relax. I promise you, and low back pain will always go away.
Does it also help with cramps?
Yeah, if cramping is caused by the psoas major muscle, and what triggers cramping is actually impingement of that genitofemoral nerve by the psoas major. So it definitely resolves cramps like nothing else. better than any medication. And there's no surgery for this that works, right? I mean, this is the only possible way to get this to let go, to reverse infertility and to get low back pain to go away.